Holbrook Travel is pleased to bring you this webinar today, where we'll be discussing the latest in air travel health and safety protocols. We're joined by special guests from two of Holbrook's partners, Delta and LATAM Airlines. As countries around the world are starting to relax their borders, a lot of travelers have questions about the safety of air travel, both right now and in the future, and about the health and safety protocols that airlines are implementing. We hope that with today's presentation, we can help demystify some of these topics and allow you the opportunity to hear the latest information directly from industry experts and to ask any questions that you may have. We'll start off hearing a brief update on the current flight situation with Holbrook Travel specifically. Then we'll hear about the Delta Care Standard and about LATAM safety and hygiene measures. We'll talk a little bit about specific international destinations and what the current reopening status is in those countries. And then we'll have time again at the end for a Q&A. Our first speaker today is Joseph O, Leisure and Segmented Account Executive at Delta Airlines. He's worked in airline and travel hospitality for over 15 years, including at Delta and America Tour USA, and he lives in New York. We're also joined by Jim McGrath, General Manager of Specialty Sales for Delta. Jim is responsible for tour operator and cruise business channels. A 34-year Delta veteran, Jim began his career in Boston airport operations. And since that time, he's held jobs of increasing responsibility, including reservations, customer service, and inside sales account management in New York. Jim has been in the tour operator sales area at Delta for over 20 years, and he's currently responsible for relationship management and revenue generation within the tour operator, cruise line, and sports and university travel business lines for Delta and their JV partners, and he's a past board member of the National Tour Operators Association. He currently resides with his family in the Atlanta area, and Jim will be helping answer some of our questions later on. Next, we're joined by Connie Cespedes, Key Account Manager at LATAM Airlines. Connie has been with LATAM for over 13 years with a background in commercial aviation, and she lives in the Miami area. And lastly, we have Lori McLaughlin, Holbrook Travel's Vice President of Customer Services. Lori has been with Holbrook for more than 30 years, and in that time, she's gained expertise in all aspects of Holbrook's operations. She is well-versed in our air operations, and if you've traveled with us before, it's very possible that she may have helped with your flight arrangements. So with that, I'll turn it over to Lori. Welcome, Lori.
Unmute. I have to unmute first. Thank you so much, Lindsay, and thank you for your time today. Just wanted to quickly just give a brief little statement here, an overview before we get started. Just to let you know that Holbrook offers complete services for all your travel needs, including your individual and group flight arrangements. And it's through our partnerships with carriers such as Delta and LATAM that we can offer you options that allow you to secure your schedule and price with the flexibility of payment timelines in many cases, which hopefully make you feel a little safer about going ahead and starting to plan your next trip now. Also, I want to give you a little bit of information about Holbrook's commitment to safety. Again, part of that, we understand that these are challenging times, but everyone needs something to look forward to. And Holbrook wants to make the planning for the future now an easier decision to you by offering more flexible terms and doing all possible to ensure a safe experience. Part of that will be in our flexibility of our booking terms. Reservations that are made for travel between now and the end of December 2021 will be fully refundable with no cancellation penalties until the final payment deadline for most programs, a few exceptions. Also, in trying to lessen the exposure, we promote small group size. It makes it easier to follow social distancing protocol and lessen exposure. Most of the Holbrook programs are already designed for smaller groups to lessen impact and enhance community engagement, so we're ready to roll with that. And we're also extremely happy to work with you for travel within your own family and friends bubble. Also to work on enhanced health and safety protocols once you're on the ground. We are working hand in hand with our partners and suppliers to ensure enhanced health and safety measures are in place. We're utilizing the frameworks that have been provided by the World Travel and Tourism Council and the Adventure Travel Trade Association to augment the local regulations for each country to ensure the health and safety of our travelers going forward. Also, just to let you know, Holbrook does provide post-departure insurance for all of our travels that covers medical emergencies. You have an option to upgrade at a discounted rate to include trip cancellation, interruption coverage, or cancel for any reason coverage where that is available. COVID is considered an illness like any other as far as that type of coverage is concerned. We understand the importance of safety and the role flying plays in the travel experience, so we felt it important to demonstrate what airlines are doing to address the health concerns. We are pleased to have Delta and LATAM representations here with us today to review the standards and protocols that are being implemented at all points along the flying experience. We're also excited about the possibilities that the new Delta LATAM partnership may bring to travel to South America. Thank you, and take it away, Joseph.
Thank you, Laurie. Good afternoon, everyone. I'm delighted to be here to share the newest safety measures and protocols that Delta has put in place, which we now call the Delta Care Standard. I'm sure some of you have already heard about Delta Care Standard and are familiar with it, but for those who are not, I'll go ahead and review the fundamentals around it today so you'll get a better understanding when this presentation is over. So if you've ever traveled on Delta, even before this pandemic, you probably heard us saying your safety is our #1 priority. And this is more than just our slogan, really. It's really a big part of Delta culture, as we've always been very committed in looking out for the safety of our customers, as well as our employees. And that is whether we're dealing with the rainstorm, snowstorm, or a virus. So not long after the breakout of COVID-19, Delta Airlines have partnered with companies like Perel, RB Group, which is the makers of Lysol, and Mayo Clinic. Now, Perel, as many of you know, is a famous brand of hand sanitizer. I think everyone knows that, right? And we've partnered with Lysol as part of the newest updates to Delta Care Standard initiative. And we're working with them to develop new disinfecting solutions and practices. And with Mayo Clinic, we're working with them to help adjust the standards and protocols to minimize COVID-19 transmission among employees and customers. Now, let's talk about what Delta Care Standard is. So Delta Care Standard is simply our new set of standards focused on providing a safer and cleaner experience when traveling. Our industry-leading multi-pronged approach provides a safer travel experience by utilizing protection at every point when traveling. Now, why did we create the Delta Care Standard? It was to strengthen the safety measures of our customers and employees, as well as to differentiate Delta brand and rebuild customer confidence when it comes to traveling. And finally, the goal of Delta Care Standard is to lead the industry in rebuilding customers' confidence and to ensure Delta Airline is the airline of choice when customers are ready to fly again. Now, we'll go through a few slides, but first we'll play a video which will show you the overview of Delta Care Standard. And after the video, we'll dive in a little deeper to review some of its key components. So let's go ahead and jump onto the video, shall we?
Hi, I'm Jeffrey, a Delta Redcoat. I know it's probably been a little while since you've been on a plane, but don't worry. I'll be walking you through all the steps that Delta's implementing to keep you safe while on board and at the airport. We call it Delta Care Standard. Delta Care Standard means you'll experience safer travels in 3 layers when you fly with us now. 1, the highest standards of cleanliness. 2, more space. And 3, safer service. These layers are important because there is no single solution. We're consulting closely with medical experts to develop Delta Care Standard. And we go beyond what's required to make sure we provide you the safest travel experience possible. At every step of your journey, you'll see Delta Care Standard in place. Every flight, every day, everywhere. A day or 2 before your flight, you'll receive an email from Delta with the latest information on what to expect, a checklist outlining how to prepare for your trip, and a link to an infographic detailing all the measures we put in place for your care. We also recommend downloading the Fly Delta app, where you can get your digital boarding pass to reduce touch points at the airport and receive important notifications throughout your trip. First off, remember your mask. They are required to be worn at the airport and on board the aircraft. Upon arriving at the airport, if you have to check a bag, we've placed floor decals throughout the waiting area so you can distance yourself from other passengers while in line. We've installed plexiglass barriers at all counters, and we're cleaning kiosks and surfaces throughout the day at check-in, Delta Sky Clubs, and gate areas. You'll also find hand sanitizing stations placed conveniently throughout the airport. These added layers of protection provide a consistently safer experience throughout your journey. When you get to security, you'll find TSA officers are now required to wear masks and gloves. They'll also ask you to scan your own boarding pass. If you are a Clear member, you can verify your identity using your eyes, enabling a touchless verification experience at security. You can head to tsa.gov to find the latest information on any changes happening. Some changes, like being able to bring more hand sanitizer, are a plus. Some of our clubs remain open. We have consolidated clubs, discontinued shower service, and we've switched from a buffet-style food option to a pre-packaged food option. At Delta Sky Club and our gate areas, you'll find additional measures of cleanliness, more space, and safer service methods in place. We're implementing one of the most important cleanliness factors you can't see. We're using an electrostatic sprayer to sanitize the aircraft. We spray and sanitize all surfaces, including overhead bins and lavatories thoroughly before every single flight. Don't worry, it's immediately safe to breathe afterwards. Every night, we spray and sanitize the jet bridge and gate areas, and we're expanding it to catering and baggage claim. Our teams wipe down and sanitize high-touch surfaces and lavatories. The Delta difference means we are committed to these cleaning measures now and always. Flight attendants and gate agents walk the cabin to spot check. And if it doesn't meet Delta's new standard for cleanliness, we are empowered to call the cleaners back onto the aircraft. Before you board, the Fly Delta app notifies you when the extensive cleaning of your aircraft is complete. As you board the aircraft, you'll find that we are boarding in smaller groups. We'll start at the rear of the aircraft and move forward to reduce contact in the aisle. At Delta, we're committed to giving you more personal space on board, reducing cabin capacity to 50% in first class and 60% in main cabin. Families will be able to sit together on board if they choose to. You'll be offered a snack bag, including a bottle of water, snacks, and a hand sanitizing wipe or gel pack. It's part of our overall effort to deliver service safely. As you settle in your seat, please let your flight attendant know if you have any concerns. We still offer world-class entertainment, so you can relax, plug in, and tune out. And you can stay connected with Wi-Fi access and free messaging. We understand that cabin air quality is critical to feeling safe. The air on all of our aircraft is completely refreshed 10 to 30 times per hour. Air flows into the cabin from above each seat and is pulled out at floor level. This helps limit person-to-person airflow. Air is then refreshed with outside air and air that's been filtered through high-grade HEPA filters, which function in a similar way to filtration systems used in hospitals. These filters remove 99.99% of particles, including viruses. To be extra safe, we replace filters twice as often as recommended. Once you arrive at your destination, remember to allow some extra space while deplaning front to back, again in smaller groups to reduce contact in the aisles. When you pick up your bag, you'll notice distancing markers and sanitizing stations throughout baggage claim, so you can stay safe even as you depart the airport. With all these added layers of protection, Delta is committed to a safer experience for your family and for ours, because without health and safety, we have nothing. But we're not stopping there. We're constantly updating best practices and improving our new standard of care based on expert medical advice. We hope to see you back on board very soon. Until then, safe travels.
Well, I hope everyone enjoyed that video. If you'd like to watch that video again or would like to share it with others, it's actually uploaded on YouTube. So you can just go to YouTube and search for Delta Care Standard, and we'll be able to easily find it. So let's go to our first slide. So the first slide talks about setting a new standard of safer travel. And you'll see that there are four main pillars of Delta Care Standard: cleanliness, more space, safer service and care, and flexibility. So when it comes to cleanliness, we're talking about the clean surfaces, laboratory cleanliness, and electrostatic spraying, which is the best way to cover all surfaces of the plane. And we spray overhead bins, seats, tray tables, screens, window shades, air vents. I mean, you name it, just about everything and everywhere. We also do cabin air refreshing every 2 to 5 minutes. And I'll talk more about this in detail later on in a different slide. So let's go to our second pillar, which is more space. So when we say more space, we're talking about placing social distancing decals throughout the airport and boarding the airplane from back to front, no more than 10 passengers at a time. And finally, blocking the middle seats. Now, blocking the middle seats is unique to Delta because Delta is the only major US airline that is doing it. And we've been getting so many positive feedbacks about this from our customers. After all, I mean, even in normal circumstance, who wouldn't want someone not sitting right next to you, right? I mean, so we're doing this obviously for a safety reason, but it's also for your comfort. And I think, this is really good for our customers. So our third pillar is safer service and care. So when it comes to this, we're talking about the fact that Delta requires everyone to wear masks, customers and employees. And we're also providing care kits throughout the airport experience and on board, like the Perel hand sanitizers, for example. And face masks and hand sanitizing wipes are always available upon request. And we're also adjusting service to reduce touch points as much as possible. Now, the fourth pillar is flexibility. And this is about providing our customers with peace of mind when purchasing Delta tickets. But I'll talk more about this on the next slide. So let's now talk a little bit about transforming the future of safe flying. Are we on to the next slide already? We should be on the second one, right? Okay, so let's talk about transforming the future of safe flying. So if you look at the bottom left corner of the slide, the first column talks about establishing dedicated division. So we've actually created a brand new department to ensure a consistently safe and sanitized experience for travelers and employees. And I think this alone shows you the sheer dedication that Delta is putting in to make the travel experience more safe for our customers and a safer place to work for our employees. Now, the second component of transforming the future of safe flying is collaborating with experts. And I've already mentioned this part in the beginning when I mentioned Perel, Lysol, and Mayo Clinic. So I'll skip this one, but I think the most important point here is that Delta is working very hard with many of the best experts out there to help us provide safer travel to our customers and safer environment for our employees to work in as well. Now, the last component here is testing Delta employees. So we were one of the first Fortune 100 companies to test all of our employees. Every one of us have been tested. And this shows you that we take this pandemic very seriously. And right now, our utmost focus is on everyone's health and safety. So let's go to the next slide, which will show how we've got the customers covered. So you'll remember from the previous slide that flexibility was one of the four pillars of Delta Care Standard, right? So to give you a few examples, when it comes to flexibility, we're providing flight credits that are redeemable through December 2022. And we've also eliminated change fees for all US domestic flight bookings permanently. And as for loyalty, medallion status benefits have been extended until January 31st, 2022. So now let's look at some of the other things Delta is doing to make travel more safe. So if you look at for preparing and arriving at the airport, we're equipping travelers with information and tools and partnering with airports and TSA to provide a safer experience. So for example, a Delta app, it's a great touch-free travel tool that provides latest travel policy and updates. And we're constantly making improvements to this app. It's already a fantastic app right now, but it's only going to get better. Next, health acknowledgements need to be completed by all travelers. And customers facing employees, they receive temperature checks before their shifts begin. Now, the second column in this slide talks about before flight and boarding. So let's look at some of the things that are included in this category. So first, Delta Sky Club, it will operate in limited capacity with increased cleaning. Electrostatic spraying is performed before every flight, and we'll actually hold that flight if the plane doesn't pass our safety checklist. Gate agents and gate display screens will notify when aircraft cleaning is completed and remind travelers about block seating and encourage safer space. The new boarding process we've already went over, but again, we're boarding from back to front, 10 passengers at a time only. Last but not least on this slide is the topic of during flight and upon arrival. As mentioned before, we are refreshing cabin air every 2 to 5 minutes using HEPA filters, which extract 99.99% of airborne viruses. I know some publications will say like 99.98 or 97, but either way, it's almost 100%, right? So in this category, let's see, we've already talked about blocking the middle seats, so we'll go ahead and skip this one, but customers can find hand sanitizer stations no more than a few steps away on every Delta aircraft, as well as throughout the airport. And we use electrostatic spraying not only in the cabins, but at the baggage claim areas and many other parts in the airport, including places like check-in areas, around the gates, jet bridges, and so on and so forth. So now let's move on to our last slide to talk about our filtration system. So Delta's state-of-the-art filtration system provides a critical layer of protection. Now, I won't spend too much time in this slide because we've already went over the fact that we do cabin air refreshing every 2 to 5 minutes, right? And the fact that we use HEPA filters on all our cabins. But let's talk a little bit more about what HEPA filter is. So HEPA stands for High Efficiency Particulate Air. And it's actually a filter technology trusted by many professionals like healthcare workers and are widely used in the hospital rooms and surgical suites. They actually depend on HEPA filters for protection from COVID-19 and other infectious diseases. So the key things to note on this slide are, number one, all Delta and Delta Connection planes are ventilated with fresh outside air or air that is recirculated through HEPA filters. Number two, Delta replaces HEPA filters on board twice as frequently as recommended by manufacturer. And number three, Delta not only replaces HEPA filters frequently, but we routinely clean the key components as well. So they are extremely well maintained. So that's pretty much end of my slide presentation, but I'll finish up here by sharing some interesting study that I came across the other day. And it's a study recently released by IATA, as well as Boeing and Airbus. And they've concluded that on a global basis, only 44 cases of COVID-19 have been associated with air travel. And during the time period, 1.2 billion people have traveled. And it's important to note that virtually all of those 44 cases occurred in the early days of pandemic, before many safety procedures were in place. And guess what? None of them were on a Delta plane. So I think this fact alone should help minimize travelers worrying about getting on the planes again to fly. And combined with Delta Care standard in mind, I think everyone should be feeling much more safe when it comes to flying again, especially on Delta Airlines. Well, that's the end. So I hope this short presentation was educational for all of you. And if you have any questions, I'll try my best to answer them for you later on. Thank you so much.
Great, thank you. Now we'll turn it over to Connie. Connie, welcome. Thank you for joining us today.
Thank you, Lindsay. Let me share my screen. Give me 1 second. Okay, here is. Okay. Hi, everyone. Thank you for attending this meeting today. As Lori said, my name is Connie Céspedes. I've been working in LATAM for almost 10 years now, and the last 4 in the sales department. I'm gonna start, today I'm gonna give you a presentation about our COVID measures for COVID-19. Let me start with a brief introduction about LATAM. As you may know, LATAM is a South American airline. Our headquarters is in Chile. We have the biggest network in South America. Before COVID, we were transporting 67 million passengers per year, reaching more than 140 destinations over the world. These are basic numbers pre-COVID. Now let's move forward to our video about how we are facing and dealing with this new normal. Okay, I hope you enjoy it. So let me see.
LATAM presents New Ways to Fly. To give you peace of mind to travel again with confidence, we will share with you everything we're doing to ensure your safety before, during, and after your next flights. We implemented new safety and hygiene measures along the 5 stages of your journey, starting with the first. Pre-flight. Before each trip, we will send you an email with your flight information, recommendations, and current protocols. Remember to include a mask in your hand baggage, since its use will be mandatory at the airport and during the entire flight. Check-in. We want to promote social distancing at the airports. So please check in online and make sure you have your boarding pass with you. By doing so, if you are traveling without luggage, you will not need to go to the counters and you will be able to go directly to the boarding gate. Also, make sure that only the people who will be traveling arrive at the airport. This way, you contribute to reducing possible crowding in public areas. If you have luggage, please follow the social distancing sign and take advantage of our automated baggage, tagging, and automatic dispatch services at the airports where they are available. Our entire staff will be wearing masks and by protocol, wash their hands regularly and also use hand sanitizer gel. Likewise, all our services, such as counters and kiosks, are cleaned continuously and are interspersed to maintain proper distance from each other. Boarding. We implemented a POS and contactless boarding system to ensure the safety of our passengers and crew. You will wait for your turn to approach the boarding gate, and while you do so, you will be able to relax, since the common areas are also regularly sanitized. On board. Before every flight, we perform a cleaning and disinfection process of all our surfaces and elements on board. All our cabins renew their air completely every 3 minutes and have HEPA filters that remove 99.9% of viruses and bacteria. Additionally, for your protection, the cabins have an air circulation system that goes from top to bottom and is combined with multiple air vents that together limit the spread of particles and diseases throughout the plane. we have taken measures on board to make your flight a safe environment, such as the mandatory use of masks by passengers and crew, hand sanitizer gel available on all of our aircraft, a simplified meal service to reduce interactions at the time of delivery, sanitization and sealing of all rest elements before each flight, and enhancement over hygiene protocols, among others. Disembarking. And finally, we want to avoid crowding while you are leaving the plane, so disembarking will be carried out by rows to guarantee enough distancing among passengers during the process. This is how our new safety and hygiene protocols are adapted to the different stages of your trip, creating a safe environment that ensures your protection when flying with us. Because in this new world, a safe flight is achieved through our joint efforts. LATAM Airlines, further together.
Okay, let's continue with the presentation. Here in this slide, you can see real pictures of our main gateways from United States, LA, Miami, and New York. As you see, we are complying with all the protocols for COVID-19. You can see on the floor the signs to maintain the social distance, and we always cleaning all the surface, okay, for the passengers. Here's the review of what you just see in the video. The boarding and disembarking, we are paying special attention just to avoid crowd. We are in the boarding process, we are calling by rows, or also on the disembarking. The MTC, in this case, the MTC, we're gonna try to keep this middle seat empty wherever is possible. No, every time we have the availability to do it, we're gonna do that to facilitate the social distance between passengers. Ventilation system, we also use the HEPA filter that renews the air inside the cabin every 3 minutes. About the cabin hygiene, we always gonna give disinfectant wipes to the passengers. They are gonna have access to the hand sanitizer and everything. Our crew is always gonna maintain the cleanness of the cabin. About our crew protocols, we adjust our crew protocols, which include the use of masks of our members all the time during the flying, boarding, and disembarking. The catering, we simplify our food servicing by minimizing the handling of items, just to have, well, it depends on the duration of the flight too. Limit each service to only one interaction. But in case the passenger needs something, they can request it. Okay, about the materials, that means the magazines that we used to find on the back of the seat, we are not gonna be able to have it right now unless you request it. Okay. We are implementing the digital boarding pass here in United States. We start already with LA. We are planning to implement that to our main airports in Miami and New York. I'm gonna let you know when this happens. The arrival at the airport should be 4 hours prior to the departure of the flight. At the airport, wherever is available, try to use always the self-service station. And when the passenger approaching to the check-in or the counter, is better just to do it by themselves, not with friends and family, just to avoid interaction with other people. New ways to fly, our passenger has to use the mask. It's mandatory all the times. And once in the plane, it's better that they remain seated and avoid moving through the cabin. Okay, maintain the social distance at the check-in, at waiting areas. And these are pictures from our airports in South America, from Santiago, Sao Paulo, and Lima. As you see, they are complying too with all the protocols due to COVID-19. This slide is about our flexibility policy for ticket purchase from October 1st, 2020. They can change within 2020 without any penalty or difference in fare. And for changes for 2021, we waived the penalty too, but in some cases, they have to pay the difference on fare. It depends of the flight and the route. Here's the good news now that South America is little by little open the borders. In this slide, you can see some of our main, roads that we have: Argentina, Brazil, Chile, Colombia, Ecuador, and Peru. The main restriction here, as you can see, is the COVID test that has to be taken 72 hours before the departure of the flight. The latest update that I just have is about Peru, that increased the window of flights to 8 hours. So that's going to be a good news for next month, starting next month. But for better information, always, I recommend to check the IATA International Travel Restriction website. Okay, this is information from IATA that already shared by Joseph about how many passengers flew since 2020, and with only possible 44 cases that be contagion in a flight. That's equal 1 in 27 million. This is a good information, important to know, that just to be, so the passenger can feel confident to travel again. Okay, so that will be it. Thank you very much. If you have any question, I will be more than happy to help you.
Great, thank you so much.
Thanks.
At this point, we'll go ahead and turn it back over to Lori.
Great, thank you so much, Joseph and Connie, for your information. And hopefully this makes people feel a little bit safer and understanding what all the air carriers are doing to provide the safest possible experience for you. Connie shared a little information about the some of the destinations that are open now in South America. Just to add a couple others that are main Holbrook destinations as well. Costa Rica, effective November 1st, will be open for all of U.S. It has opened in with certain states through different periods, but as of November 1st through all of the U.S. Belize is also open for U.S. travelers, as well as Mexico, Tanzania. If you're ready to go to Africa, they're open as well. In most cases, a negative COVID test is required within 72 hours of departure. Just be sure to read the instructions for that carefully. Some mention from arrival time, some say from your first flight. So make sure you're reading all the rules and restrictions carefully. Things are changing rapidly, so it's hard to say, here's the list and let you know that this is all ready to go, since things are so fluid and change so rapidly. So here are a few resources. The IATA Center that Connie mentioned is listed here as well, as a couple of other resources to kind of give you an idea of the status in each country for travel for U.S. citizens. You may want to check the travel.state.gov site that goes to the embassy for that particular country. So you're really just looking strictly at U.S. people. But the others are good for that information as well. Just make sure you note when it was last updated and make sure you have the most recent information possible. And when we share the presentation with you later, these links will be available to you there. So don't try to scribble them all down right now. Anyway, so just wanted to also let you know that we are moving forward with some domestic programming too, that even traveling though in the US, be careful because there are restrictions still in different states as well. So just because you're traveling in the US doesn't mean you don't need to pay attention to what those restrictions might be. So make sure you're following up on that as well. And we look forward to having the opportunity to have you and your participants traveling with us in the future, traveling with Delta and LATAM as well, and exploring their new partnership that they have together. And thank you so much for attending. I think we'll do a few questions, try to cover a few of the questions now, Lindsay.
Great, thank you. Yeah, we've got a lot of great questions already, and please continue to send those in using the Q&A function so that we can share them with our panelists. We'll try to get through as many as we can, and if we're not able to get to your question, we'll do our best to follow up afterwards. So please send those our way. I'll go ahead and start off. We have a couple questions about masks, and so I'll kind of try to group those together. One question I'll address to both Connie and either Joseph or Jim, whoever would like to answer. Are there any restrictions that your airline is imposing as far as the types of masks that people are wearing? Are there any minimum requirements, or are net gaiters, that sort of thing, allowed, or are there any other restrictions, basically?
On the mask question, the one rule that we do have is it cannot have an exhaust port on the mask. So you can use many types of masks, but we don't accept those with the exhaust port. And if you don't have the correct mask on, we do have masks available to offer to our guests.
Okay, I think that kind of also addresses, there's another question, if there's someone on the airplane who is not wearing a proper mask or is not wearing their mask properly, what are the procedures for that? How is that handled?
Well, for Delta, we will obviously take the high road and ask them to please put their mask back on. And if they don't have one, we will offer them one. Unfortunately, if they do not comply, we do actually ban people from our aircraft for those that do refuse to wear a mask. Unfortunately, there are a few that don't, and they will be asked to leave if they're still on the ground, if they won't comply.
Yes, the same with LATAM, because the use of mask is mandatory. And also it's important to check the destination, because some country is different. In the case, for example, in Peru, they only are allowed to use the mask, the chirurgical mask, and also the face shield. So these two things to Peru, but maybe for any other destination, it's gonna be just any other mask, but the mask is mandatory all the time. Unless we have an exception, medical condition or something like that, right? But generally it's mandatory.
Okay, thank you. And is anybody aware, does TSA require face masks for everyone who passes through security?
They encourage masks, but they do not require them. And if you're wearing one, they'll ask you to bring it down so they can see your face to check your ID. So.
Gotcha. Thank you. Let's see here. We have, this was addressed, I think, in both of your presentations, but we do have a few questions about the middle seats remaining unoccupied. It sounds like for both LATAM and Delta, you make every effort to leave those middle seats unoccupied unless maybe it's a group of family traveling together. Is that correct?
Yeah, unless
Right.
it's a family, we're trying, we have the space available. We're gonna try to leave this middle empty seat.
And we've made a commitment to keep ours open until January 5th, just to build more confidence and to create more comfort for our flyers so they can be more comfortable flying and get used to traveling again.
I saw, sorry, one question about the middle seat being a good thing to give a little bit more space, but there's still, the row distance is not different. Are you doing any staggering, trying to stagger in some way to accommodate that?
We do stagger on some of the rows, but also I think some of what the part is because you have somebody in front of you, the seat back is blocking some of you, but sitting next to somebody, you're more apt to spread some germs as well. But on our aircraft, we do try to spread people around the cabin, even in the forward cabin.
Okay. We have questions about air recirculation. I'll direct this to Jim first. Is cabin air also refreshed and recirculated while the plane is gated and taxiing?
Yes, it's not done as frequently on the jetways, but on the airplane it is, and it's hooked up to a ground system that is recirculating that air. Not quite as frequently as up in the sky, though.
Okay. And Connie, I guess same question for you.
Yeah, actually, I don't have that information, but I can look for that. But I think the HEPA filter clean that, but not so frequently as during the flight.
Okay. This is a question for Connie. For LATAM flights in South America, are there any differences in the safety measures between international flights versus domestic flights?
No, the safety measures are the same. The only thing is the restrictions, because I mean, within Peru for domestic flights, you don't need the COVID-19 test, for example. For international flights, you do need, but the use of mask and everything else, the social distancing is the same.
Okay. Lori, I'll put this question to you. Can U.S. travelers who are connecting to other countries via a third country, are U.S. travelers allowed to connect to other countries via a third country if that stopover point has restrictions on Americans entering still?
Yeah, this is something that as different countries were opening up, the connection points are in general most time allowed. I can't say anything's 100% these days. For instance, as Costa Rica was beginning to open, but Florida was not allowed, people were still able to fly via Florida to get there. They just were not allowed to leave the airport at all. So you just to make your connection, you can't leave the airport, and it was a maximum of 18 hours that you could be layover. And who would want to stay 18 hours in the airport? I don't know. The same was effect for Copa Airlines that goes through Panama, or carriers that go through other for Managua and those type of things. Before those countries were opened up, they were allowed to make those connections so they could get their flight services going and make those connections in that manner. So this, of course, is something you want to double check, make sure of, but it is something that has been ongoing.
Okay. And I'll put this one to you also, Lori. Is a 4-hour check-in still recommended for international flights?
As Connie mentioned, I think normally it was 3 hours was the recommended, and probably most people tried to do it in 2 or less. But now with the additional spacing, social distancing protocols, as well as just the extra time that it may take to make sure you have all the documents that you need, that you have your test, and that you've uploaded the health screening forms that particular country may require, that, etc. All these things, and going through these things and doing it with the spacing that's required as well, could definitely take longer. So you want to, I would say, shoot for 4 hours if at all possible. Even for domestic flights, Jim, if you maybe know, even for domestic flights, I would try to go for 2 hours for the same reasons. Would that be accurate?
I would say 2 hours on that, on the domestic flights. Keep in mind the lines are pretty small right now.
Right, that's true too.
So
yeah.
It's not a long TSA line, but it's always good just to make sure to allow for social distancing in both. If you're checking in, obviously, we encourage everybody to use their app on their phone for contactless check-in. And if you have to drop a bag off, give yourself extra time to make sure that you're giving that social distance time, as well as in the TSA line, give yourself extra time there.
Yeah.
Okay, that's great.
I see a note about someone asking about check luggage or carry-on as well. I'm not sure. I mean, in the past, people have been having to carry on more because of luggage fees, et cetera, coming into play as well, and with some fares that are being used. But do the carriers feel now that it would be better not to have the carry-on for the safety reasons?
I think it's still a personal choice. Keep in mind, we're boarding from the rear of the aircraft. So those folks that would normally try to book that seat as far forward as possible, you know, the flights are not full. So there's plenty of overhead space. But do you want to carry it all the way to the back of the airplane? Or it's a personal choice either way.
Yeah, I agree. It's a personal choice because on the other hand, you have to go to the carousel and you're going to have to be in contact with other people. So if you take your carry-on, I mean, for me, it's better because you don't have to go to the crowd.
Yeah, and you are, as part of the disinfecting process, the overhead bins are all being done beforehand. So hopefully, at least there's not anything lingering there that should be an issue that you don't bring with you.
And every overhead is electrostatically sprayed, as Joseph showed in the video. So every nook and cranny of that cabin is actually electrostatically sprayed in advance of every single flight. So that part is safe.
About this question from South America and the quarantine period, it depends on the country. But as I know, most of the country doesn't require the quarantine period now, only the COVID test.
If you show up and they are doing health screenings as well, though, once you get there. So if you're showing symptoms, they may, in some cases, may ask you to take another test, or may ask you to, and so you may end up having to quarantine potentially there. So it's all about staying healthy before you go as well.
I'll put this question to Connie first. If Delta and LATAM have small partner airlines that fly locally, are those airlines subject to the same protocols?
I think so, yeah, because basically they are the same safety protocol for all the airlines, that we're trying to keep the social distance, to try to avoid contact with other people, use the mask and everything. I think it's going to be almost the same protocols. It is the same protocols that we're handling.
So like for regional carriers, Jim.
Mm-hmm.
Yes, and all of our partners, our connection carriers and our partners, they have the same protocols in place. So whether you're on a mainline jet or a Delta connection regional aircraft, the same protocols and processes are in place from curb to carousel throughout the whole experience.
Great. I have a question here for you, Jim. How often are Delta employees tested for COVID?
Well, actually, every Delta employee has been tested, and every employee, especially customer facing, have to check an app every morning on how do they feel, do they have a temperature, etc. And the consistency or the amount of times you're checked aren't actually consistent across, like somebody like myself who's not in customer contact every day, whereas somebody at the airport is checked very regularly and their temperature is checked each morning. Delta works with the Mayo Clinic to review those in high risk positions, that they get tested more frequently than others. So is really not a one size fits all rule on that.
Sure. Let's see, we have a couple questions about the length of the flight duration. Is there a difference in safety between shorter versus longer flights? So for example, a 2 to 4 hour flight versus an 8 to 10 hour flight. I know you both of our presenters talked some about the air filtration systems that are in place. Does that length of flight make any difference in terms of safety?
As far as I know, it's relative, it depends your choice. I mean, the HEPA filter works every 3 minutes. It doesn't matter how much time is the flight, but it's a personal choice. I think it's the same like you go to somewhere, to the supermarket, the more time you spend outside, I mean, around people, the more chances you have to get COVID or something.
Yeah, I think with the longer flights is, how do we make sure that the people keep their mask on for the longer periods of time would be the main issue there. But as you mentioned, as far as the air filtration system, et cetera, that's all working constantly regardless of the length of the flight.
Yeah.
But it goes back to the standard common sense items of keep your hands washed with either Purell or wear your mask. Keep your touch points around you clean, and you should be fine whether it's 2 hours or 10 hours. Just keep with the regimen that you have, and you should be fine.
Great, thank you. I think we have time for maybe one or two more questions, and then we'll wrap up. We have one question, and I will, let's see, I'll put this to Jim first. There's a big concern for families with very young children not, quote unquote, complying. Are you finding alternative ways to help with this by either placing families in the back of the aircraft, or are there other systems in place for helping ensure that families are able to comply?
Well, we do seat families together. We do try to work with them. Nobody wants to penalize. As a parent, I mean, many of us know sometimes a 3, 4, 5-year-old has a mind of their own, and we kind of have to work with them. And those parents know how to get their children to comply. And with them being seated together, there may be times where the kid's pulling their mask off, but the crew members, they use good judgment in working with them and trying to, facilitate an environment where they can keep their children relaxed and comfortable, because sometimes when you build too much anxiety, that's when the children will be pulling the masks off. So we do work with them on a case-by-case basis.
Great, thank you. Let's see, I think we'll finish up with this last question. We've talked a lot about time spent on the airplane. We've had a few questions about time in the terminal and in the actual airport. Do either of you have any recommendations for people who will be in the terminal? Is it just to follow the same safety precautions that you would normally as far as social distancing and wearing your mask and all that?
Washing your hands.
And washing your hands.
And then are the airports themselves I'm assuming have similar strict protocols regarding the keeping things clean and disinfecting, et cetera?
And we have strict protocols in our gate areas, but throughout the airport terminals, you'll find Purell dispensers everywhere. And it just comes back down to wear your mask, wash your hands, and don't put your hands on your face, and don't touch everything in sight, really.
Yeah, you're never gonna find the airport that clean as now. Yeah, I already traveled twice. I mean, during pandemic, and everything is so clean and pure.
Yeah, and if you see someone that has their mask down, step the other way. Make the distance a little bit more than social.
And if I may add, I think this question came before about the lavatory, right? So, like I said before, our cleaning crews, they extensively wipe down surfaces and do the electrostatic spraying everywhere. But even over the course of flight, the flight attendants now have materials on board, such as like wipes, masks, gloves, that are prepackaged and used to clean the lavatory. So in a longer flights, our flight attendants will make sure that, the high touch places are cleaned. So I think that's going to make people feel more safer.
Thank you. Yeah, great.
You're muted.
Lori.
I do see one question I'd like to address, if you don't mind, asking about, and in Peru may be different. I have to go back and read the requirements, but in general, if it talks about taking the COVID test prior to departure from the U.S. using a U.S. carrier, and then when you get to the country, if you're on an internal flight, does that still help you? Basically, whether you're flying a U.S. carrier or a non-U.S. carrier, the requirement is for your entry into the country. And once you're in the country, then the flights, you're already have met the requirements. So there's nothing different that you need for the internal flights. Would be correct, Connie?
Yeah, correct.
So yeah, so the test is if you've met the requirements to be able to arrive in the country, then after that, it's just as if you live there and are taking a flight, basically. As far as that's concerned, there's no additional protocols for that. And then yes, also I'll be making my first trip actually in November, just going to Puerto Rico, but they still require the COVID test. So I'll have the fun trip of trying to make sure it gets done within the 72 hours and the anxiety of whether I've gotten my result back in time. hoping to try to go do that with my local CVS here. And so there are some.
It takes 7 days in the CVS.
Pardon me?
Be careful. It takes 7 days in the
It
CVS.
better not.
Yeah.
That won't work. That doesn't help. Anyway, so we'll see. Go from there, I guess. So yeah, that's definitely going to be a challenge. But as more countries for travel, even domestically, as I said, require in some cases these testing, there's surely will become better facilities to make that happen as well. So that's just want to make sure I covered that.
Yeah.
Okay, well, thank you so much. I think at this point we'll go ahead and wrap up. I want to say thank you so much to our speakers today, Joseph, Connie, Jim, Lori. Thank you so much for sharing your expertise and the latest updates on what's going on in the air industry. We really appreciate it. And today's presentation has been recorded. We'll be emailing out a link to that recording along with the resources that were mentioned during the presentation. And thank you to all of us, thank you to all of you who joined us today for this webinar. We really appreciate it.
Thank you.
Thank you.
Yeah, thank you so much.
Bye-bye.
Take care.
Bye.
Bye.